Question number 1. What is the primary nursing action when a patient in the ICU develops sudden chest pain and shortness of breath? The correct answer is option B. Notify the physician immediately. Question number 2. Which parameter best indicates adequate tissue perfusion in a critically ill patient? The correct answer is option C. Urine output. Question number 3. When should the nurse section a tracheostomy patient on mechanical ventilation? The correct answer is option B. When coarse breath sounds are heard. Question number 4. Why should a nurse monitor central venous pressure (CVP) in a critically ill patient? The correct answer is option C. To evaluate fluid volume status. Question number 5. What is the most common early sign of hypoxia in a critical care patient? The correct answer is option B. Restlessness. Question number 6. Which drug is most commonly used as a first-line treatment for ventricular fibrillation during cardiac arrest? The correct answer is option C. Epinephrine. Question number 7. When preparing to administer blood in the ICU, what should the nurse check first? The correct answer is option A. Blood type and cross match. Question number 8. How should a nurse position a patient with increased intracranial pressure (ICP)? The correct answer is option B. Head elevated 30 degrees. Question number 9. Why is early ambulation encouraged for post-operative critical care patients? The correct answer is option B. To reduce deep vein thrombosis risk. Question number 10. What should a nurse do if a patient's arterial line waveform suddenly becomes flat? The correct answer is option A. Check for disconnection or air bubbles. Question number 11. Which assessment finding indicates effective CPR in an unresponsive patient? The correct answer is option B. Return of pulse. Question number 12. What is the most important nursing intervention for a patient on neuromuscular blocking agents? The correct answer is option B. Ensuring airway and ventilation support. Question number 13. How should the nurse manage a patient with severe hypoglycemia in the ICU? The correct answer is option A. Administer IV dextrose immediately. Question number 14. When caring for a patient with multiple organ dysfunction syndrome (MODS), which goal is most important? The correct answer is option B. Maintain adequate tissue perfusion. Question number 15. Which ventilator alarm requires the most immediate nurse action? The correct answer is option D. Power failure alarm. Question number 16. What is the priority nursing action during patient seizure in the ICU? The correct answer is option C, protect the airway and prevent injury. Question number 17. Why should a nurse monitor potassium levels in a patient receiving digoxin therapy? The correct answer is option A, hypokalemia increases digoxin toxicity. Question number 18. How can a nurse best prevent ventilator associated pneumonia VAP? The correct answer is option A, maintain closed suction system. Question number 19. Which clinical finding suggests early septic shock? The correct answer is option B, warm skin and bounding pulse. Question number 20. What is the first nursing step when a patient's chest tube becomes accidentally disconnected? The correct answer is option B, reconnect using sterile water seal. Question number 21. What is the most reliable indicator of fluid resuscitation effectiveness in a shock patient? The correct answer is option C, adequate urine output. Question number 22. Which medication is most commonly used to treat bradycardia in a cardiac emergency? The correct answer is option C, atropine. Question number 23. When caring for a patient with acute respiratory distress syndrome ARDS, what is the primary nursing goal? The correct answer is option A, maintain adequate oxygenation. Question number 24. How should a nurse assess the effectiveness of pain management in an unconscious ICU patient? The correct answer is option B, observe vital signs and facial expressions. Question number 25. Why is continuous ECG monitoring essential for patient on potassium infusion? The correct answer is option B, potassium affects cardiac rhythm. Question number 26. What is the most immediate nursing action when a patient endotracheal tube becomes dislodged? The correct answer is option C, provide manual ventilation with embo bag. Question number 27. Which laboratory test result indicates metabolic acidosis in a critically ill patient? The correct answer is option B, pH 7.28, HCO3 16 milliequivalent per liter. Question number 28. When should a nurse replace IV tubing for total parenteral nutrition? The correct answer is option B, every 24 hours. Question number 29. What is the first nursing action during a code blue emergency? The correct answer is option B, call for help and activate the code team. Question number 30. Which nursing intervention prevents pressure ulcer in immobile ICU patients? The correct answer is option C, reposition the patient every 2 hours. Question number 31. When monitoring a patient receiving dopamine, what parameter should be closely observed? The correct answer is option B, urine output. Question number 32. Why is the Glasgow Coma Scale GCS used in critical care? The correct answer is option B, to assess level of consciousness. Question number 33. What should a nurse do if the ventilator alarm indicates high pressure? The correct answer is option A, cheek for secretions or tube kinking. Question number 34. Which IV solution is most appropriate for treating hypovolemic shock? The correct answer is option C, 0.9% normal saline. Question number 35. When caring for a patient with acute myocardial infarction, what is the nurse's priority assessment? The correct answer is option B, pain and cardiac rhythm. Question number 36. What should the nurse monitor closely in a patient receiving intravenous nitroglycerin? The correct answer is option B, heart rate and blood pressure. Question number 37. How can a nurse detect early sign of hypovolemic shock in a trauma patient? The correct answer is option B, increased pulse and decreased urine output. Question number 38. Which nursing intervention prevents hypothermia during massive blood transfusion? The correct answer is option A, use blood warmers. Question number 39. What is the most important nursing step when administering IV morphine to a critical patient? The correct answer is option A, monitor respiratory rate frequently. Question number 40. When caring for a mechanically ventilated patient, how should the nurse prevent barotrauma? The correct answer is option B, increase PEEP level. Question number 41. What is the nurse's priority when caring for a patient receiving continuous renal replacement therapy, CRRT? The correct answer is option A, monitor for signs of hypovolemia. Question number 42. Which condition require immediate discontinuation of a blood transfusion? The correct answer is option B, sudden chills and back pain. Question number 43. When caring for a patient with chest trauma, what finding indicates a possible pneumothorax? The correct answer is option B, hyperresonance and absent breath sound on one side. Question number 44. Why is lactate level monitored in patient with septic shock? The correct answer is option B. It indicates tissue hypoperfusion. Question number 45. How should a nurse respond if a patient in the ICU develops sudden bradycardia while on a ventilator? The correct answer is option B. Assess airway, oxygen and circulation. Question number 46. Which nursing intervention prevents aspiration during enteral feeding? The correct answer is option A. Keep head of bed elevated 30 to 45 degrees. Question number 47. When caring for a patient with increased intracranial pressure, what nursing action should be avoided? The correct answer is option B. Frequent suctioning without need. Question number 48. What is the best nursing action if a patient receiving IV potassium report burning at the infusion site? The correct answer is option A. Stop the infusion immediately. Question number 49. Why is sedation evacuation performed for mechanically ventilated patients? The correct answer is option B. To assess neurological status and readiness to wean. Question number 50. What sign indicates early respiratory failure in critical care patient? The correct answer is option B. Restlessness and tachypnea. Question number 51. What is the most appropriate nursing intervention for a patient on vasopressor therapy? The correct answer is option A. Monitor blood pressure frequently. Question number 52. When should a nurse suspect cardiac tamponade in a post-operative cardiac surgery patient? The correct answer is option B. Rising central venous pressure with hypotension. Question number 53. How can a nurse identify early sign of ventilator-associated pneumonia (VAP)? The correct answer is option B. Increased sputum and fever. Question number 54. What action should the nurse take first if the pulse oximeter reading drops suddenly? The correct answer is option A. Check the proper probe placement and circulation. Question number 55. Why is propofol infusion used cautiously in critical care settings? The correct answer is option B. It can lead to respiratory depression and hypotension. Question number 56. What is the nurse's immediate action when a patient develops chest pain during hemodialysis? The correct answer is option B. Stop dialysis and notify physician. Question number 57. When caring for a patient with acute pulmonary edema, what should the nurse do first? The correct answer is option A. Administer prescribed diuretics and oxygen. Question number 58. What parameter help the nurse evaluate adequate perfusion after fluid resuscitation and burn shock? The correct answer is option A. Capillary refill and urine output. Question number 59. Wet nursing assessment findings suggest digoxin toxicity. The correct answer is option A. Bradycardia and visual disturbances. Question number 60. How can a nurse minimize intracranial pressure in a head-injured patient? The correct answer is option A. Avoid neck flexion and maintain head alignment. Question number 61. What is the priority nursing intervention for a patient with a suspected spinal cord injury? The correct answer is option A. Keep the patient flat and immobilized. Question number 62. Which finding indicates improvement in a patient with cardiogenic shock? The correct answer is option B. Warm skin and increased urine output. Question number 63. When caring for a patient with acute pancreatitis in the ICU, what is the nurse's primary goal? The correct answer is option A. Control pain and prevent complications. Question number 64. Why should a nurse monitor for rebound hypertension when discontinuing vasopressor therapy? The correct answer is option B. Sudden withdrawal increase vascular resistance. Question number 65. How can a nurse detect early sign of acute kidney injury in a critical care patient? The correct answer is option A. Decreased urine output and rising creatinine. Question number 66. Wet nursing action is essential before administering neuromuscular blocking agent. The correct answer is option A. Ensure ventilatory support is available. Question number 67. What is the best nursing intervention for a patient experiencing acute anxiety and dyspnea in the ICU? The correct answer is option A. Reassure the patient and provide calm communication. Question number 68. When should a nurse administer naloxone to a patient in critical care? The correct answer is option B. When the respiratory rate is below 8 beats per minute due to opioid. Question number 69. Which action help prevent deep vein thrombosis in bedridden ICU patient? The correct answer is option A. Apply compression stocking and perform leg exercises. Question number 70. What should a nurse do if a patient's ICP monitoring device shows unsustained high pressure? The correct answer is option A. Notify physician and assess for causes immediately. Question number 71. Why is blood glucose monitoring important in septic ICU patients? The correct answer is option A. Hyperglycemia worsens infection outcomes. Question number 72. When caring for a patient with a chest tube, which finding requires urgent action? The correct answer is option A. Continuous bubbling in the water seal chamber. Question number 73. How should a nurse manage a patient showing early sign of hypoglycemia while in insulin infusion? The correct answer is option A. Stop infusion and give IV glucose. Question number 74. What parameter is most important to monitor during magnesium sulfate infusion? The correct answer is option A. Deep tendon reflexes and respiratory rate. Question number 75. When caring for a born patient, which urine output value indicates effective fluid resuscitation? The correct answer is option B. 30 to 50 milliliter per hour. Question number 76. Why should a nurse avoid hyperventilating a patient during manual resuscitation? The correct answer is option A. It decreases cerebral perfusion. Question number 77. What is the nurse's immediate action when a patient ventilator suddenly stops working? The correct answer is option A. Provide manual ventilation with embu bag. Question number 78. Which electrolyte imbalance increases the risk of cardiac arrhythmias in ICU patient? The correct answer is option A. Hypokalemia. Question number 79. When caring for a patient after cardiac arrest, what is the nurse's priority goal? The correct answer is option A, maintain adequate oxygenation and perfusion. Question number 80. How can a nurse evaluate the effectiveness of mechanical ventilation? The correct answer is option A, monitor ABG values and patient's clinical response.